Entitled CO2. It's the one number I've seen people get very confused about, and hopefully we can simplify this. We're going to be quickly discussing the number, so the 35 to 45, what that means. We're going to be looking at the graph, how to make better sense of that, as well as how these numbers and this tool can be used very effectively during CPR, during intubation, and during patient transfer. Let's jump right in. So ETCO2, which is entitled carbon dioxide, is pretty much the number you get when you attach your monitor or whatever device you have onto the patient, whether it's side stream or mainstream. What's important is to realize is that the number we see is how much carbon dioxide a patient is breathing out. And so when we see a number between 35 and 45, we say, well, that is a normal range. If it's high, we assume the patient is breathing out too much or a lot of carbon dioxide. And if it's too low, we assume that the patient is not breathing out enough carbon dioxide. It is important to realize that this number does not indicate volume. It doesn't tell you how much air, it just gives you a number of carbon dioxide. The graph, which looks something like this, is a representation of how much carbon dioxide is being breathed out. So from A to B is when you are breathing in, when there shouldn't be any carbon dioxide going past the sensor. Then you have B to C, where you have the start of your exhalation. And then you have your C to D, which is the end of the exhalation. The D point is where it reads the number for your ETCO2, end of your tidal volume. And then from there it drops straight down, and that is when you start to inhale again. So that's pretty much the graph. So it's really important to realize that the number is telling you how much carbon dioxide someone's breathing out. It doesn't tell you how much carbon dioxide is in someone's blood. When we see a low ETCO2, we assume the patient is not breathing out enough carbon dioxide, or that they are breathing out too little carbon dioxide. And so we slow down our ventilations to try and help them not breathe out so much carbon, or help that number get back to normal. But actually what we need to realize is that that is a sign of shock. What's happening is that ETCO2 relies on perfusion, on blood getting around the body. If I am in shock and my blood pressure is in my boots, my cells continue to make CO2 as normal, but the blood is not transporting the CO2 to my lungs, and that is not being breathed out. And so if you were to look at my PCO2, my amount of carbon dioxide in my blood, compared to my ETCO2, the carbon dioxide in my capnography, my blood will be full of CO2 and my capnography will be very low because the CO2 is not being transported out. So when we see a low ETCO2, it's probably not an accurate reading of the body's CO2, and the patient's probably in shock, and we should continue to ventilate as normal. The other thing is that if we see a high ETCO2, we think, oh gosh, it's high, we need to ventilate faster because they have too much carbon dioxide. But actually, we should just continue to ventilate as normal as long as that number is not climbing and climbing and climbing. If the number is climbing, it means the body is producing exponentially more ETCO2 or CO2, and that means that we need to try and catch up. Maybe you can increase your ventilations, but you must realize is that to try and change the body's pH or to try and cause a respiratory compensation, you have to drastically increase your ventilation, and that doesn't even make a big difference. So we should just continue to ventilate as normal, and we should realize that the number is high because we are breathing out lots. It's not like there's a mistake and the number is high and now we need to catch up to the number. The number is representative of what is currently happening, not what we're trying to do or what we're trying to achieve. It is what is happening. ETCO2 is fantastic in a range of areas and places in emergency medical care, specifically CPR. You can tell if you're doing good enough CPR. If your ETCO2 is less than 10, your compressions are not adequate. If your ETCO2 suddenly spikes up high and you now have ROSC, if it goes from 10 and it jumps to 40, or if it's 20 and it jumps to like 50, 60, generally it needs to double drastically, and that is a really reliable sign of ROSC. The other thing, or the other place where ETCO2 is really useful is asthma. You have these shark fins. It's like a big shark fin, and then it drops. And the reason why that's amazing is because it's super sensitive, and the moment you put it on a patient who's intubated and they have air trapping, like asthma or whatever the case is, COPD, you will see these shark fins, and it's a really good indicator that you need to start to treat for air trapping or asthma. The other place where ETCO2 is fantastic is obviously in intubations when you're placing an advanced airway, because it either confirms or it doesn't confirm. It's not like you're going to get a negative if you put it in the stomach. ETCO2 is also a now vital sign, not like SATs. If you watched my last video, is that there's SATs lag. So what you're seeing on the monitor is maybe a minute in the past, where what actually is happening is that ETCO2 is now. If the patient stops breathing now, the ETCO2 stops now. If the patient starts breathing, the ETCO2 starts. There's no lag in between. Whereas with SATs, you have that SATs lag of a minute or two. If you don't know what I'm talking about, jump to my last video, I explain it all there. These are really great aspects of ETCO2. So I hope I was able to simplify that. There tends to be quite a bit of confusion about the number we're seeing. You know, like if it's high, we need to ventilate faster. If it's low, we need to ventilate slower. My next video will be on blood gases and how that can relate to pre-hospital care. And we're going to try and simplify that so that it just makes more sense. Hope you guys enjoyed this. Please like, subscribe, comment. It really helps me out. And if there's any topics you guys would like me to redo or tackle on in the future, I would really appreciate that. And we'll see you in the next video.